4 herbs that have clinical support for pain, swelling, bruising, and inflammation. Yet, most clinicians never learn how to use them. Today, I'll show you how they actually work. I'm a combat medic veteran from Desert Storm in Afghanistan, a family nurse practitioner, and a fellowship trained in integrative and complementary medicine through George Washington University. This is part 1 of a 3-part Herbal First Aid Essential series. Research shows that turmeric can reduce arthritis, pain, and inflammatory markers. Ginger reduces nausea scores in clinical trials. Calendula speeds up wound healing compared to standard care, and Arnica reduces swelling and bruising after soft tissue injuries.
Conventional training downplays botanicals because herbs are not patentable. That means fewer large clinical trials are funded. Medical curricula spend little time on herbal mechanisms, drug interactions, or sourcing. That is a structural blind spot, not a failure of plants. Traditionally, arnica was carried by alpine climbers. Turmeric has been used in Ayurvedic medicine for thousands of years. Ginger has soothed digestive upset across Asia for centuries. Calendula was treasured. A European wound salve. Stay with me because most people use at least one of these incorrectly, and I am going to show you the 3 biggest mistakes later in this video. Arnica contains sesquiterpene lactones that calm inflammatory signaling. Turmeric's curcuminoids inhibit cyclooxygenase 2 and 5-lipoxygenase pathways. Ginger's gingerols modulate serotonin receptors. Calendula's flavonoids support collagen production and new blood vessel growth. Modern clinical benefits include faster bruise resolution, reduced swelling and soreness, improved comfort with nausea, and cleaner healing of minor wounds. Quick facts. Arnica, soft tissue swelling support. Turmeric, systemic inflammation, modulation. Ginger, nausea and digestive discomfort. Calendula, minor wound environment support. If you find this helpful, please like and subscribe. And check my Amazon and eBay storefronts under the Holistic Health section for vetted options. High-dose turmeric should be avoided during pregnancy. Ginger may worsen severe reflux. Never apply arnica to open skin. Calendula is very safe but can rarely bother those allergic to ragweed. Turmeric can increase bleeding risk when combined with anticoagulants. Ginger can also potentiate blood thinners. Calendula has minimal interaction risk. Arnica must remain topical. Rapid use cases. Arnica, sports bruises and minor sprains. Turmeric, joint stiffness days. Ginger, motion or morning nausea. Calendula, irritation around scrapes. Arnica gel can be applied 2 to 3 times daily to clean unbroken skin. Curcumin capsules work best at 500 to 2,000 milligrams per day with piperine for absorption. Ginger can be used as tea, capsules, or crystallized pieces. Calendula salve is applied 2 to 3 times daily to clean minor wounds. Dosing, snapshot, arnica gel, thin layer 2 to 3 times per day. Curcumin, 500 to 2,000 milligrams per day with piperine. Ginger, 1,000 to 1,500 milligrams per day. Divided, calendula, topical 2 to 3 times per day. The 3 biggest mistakes are applying arnica to broken skin, doubling turmeric doses too quickly, and taking ginger on an empty stomach. Myth 1, turmeric works instantly. Fact, it builds over days. Myth 2, arnica heals bones. Fact, it supports soft tissue. Myth 3, ginger must be tasted. Fact, capsules work systemically. Myth 4, calendula is cosmetic. Fact, it supports collagen. Myth 5, more curcumin equals more benefit. Fact, absorption plateaus. Myth 6, topical herbs are weak. Fact, skin is pharmacologically active. Arnica for bruising, turmeric for inflammation, ginger for nausea, calendula for wound healing. Bottom line, these herbs are safe, affordable, and useful for everyday injuries. And stay with me, because in part 2, we will cover 4 herbs for immune support and minor infection control. You will find part 2 linked on screen and in the description. Comment which of these 4 herbs you have tried and how they worked for you. This is healing. This is resilience. This is alternative medicine. As an Amazon and eBay associate, I may earn from qualifying purchases at no extra cost to you. These videos are for educational purposes only and are not intended to diagnose, treat, cure, or prevent any condition. Always consult your licensed healthcare provider before starting new herbs or supplements.